Atrial functional mitral regurgitation occurs secondary to left atrial disease without left ventricular dilatation and intrinsic mitral valve disease. Atrial functional MR typically occurs in the setting of long-standing atrial fibrillation. It is associated with increased mortality risk and hospitalization for heart failure. Reported prevalence of atrial functional MR in patients with AF vary between 3 to 15%. These patients have worse clinical outcome. Dilatation of the mitral annulus, atriogenic tethering of mitral leaflets, and insufficient mitral leaflet remodeling are thought to be important pathogenetic mechanisms of atrial functional MR. Insufficient leaflet remodeling leads to annulus to leaflet area imbalance. In addition, reduced annular contractility, increased wall stress by flattened saddle shape of the annulus, and left atrial dysfunction may be important triggers for atrial functional MR. Evidence for atrial functional MR in atrial fibrillation was provided by a retrospective study of patients undergoing first AF ablation. Of the 828 patients screened, those with echocardiogram at the time of ablation and at 1 year clinical follow-up were included. The study cohort of 53 patients had at least moderate MR. A reference cohort of 53 patients was randomly selected from 660 patients with mild or less MR. The effect of restoration of sinus rhythm was assessed by follow-up echocardiogram. It was observed that MR patients were older than controls and more often had persistent AF, 62% versus 32%. Patients with MR had larger left atria but similar left ventricular size and ejection fraction. Patients in continuous sinus rhythm had greater reductions in left atrial size and annular dimension. They had lower rates of significant mitral regurgitation, 24% versus 82%. Study authors concluded that AF can result in atrial functional MR and that it improves if sinus rhythm is restored. Surgical considerations of atrial functional MR are different from ventricular functional MR. Surgical treatment is currently the most reliable option for atrial functional MR. A retrospective study analyzed 10 patients with chronic AF who underwent mitral valve repair for atrial functional MR. All had chronic heart failure symptoms and at least one prior admission for heart failure complicating severe MR. Ring annuloplasty was performed in all patients. Concomitant tricuspid valve repair was also done in all patients. There was no mortality or readmission due to heart failure during a follow-up of 10 to 52 months. MR at the most recent examination was mild or improved in degree in all patients. Left atrial volume index decreased and New York Heart Association functional class improved dramatically. Mitral valve adaptation to isolated annular dilatation in atrial functional MR due to AF has been evaluated by three-dimensional echocardiography. Of the 86 patients in the study, 53 had non-valvular persistent AF without left ventricular dysfunction or dilatation. 33 were normal controls. Total mitral leaflet area was 22% larger in AF patients than in controls. As annular area increased, adaptive indices mitral leaflet area to annular area ratio and mitral leaflet area to closure area plateaued. MR increased as the ratio of mitral leaflet area to closure area decreased. Though the posterior to anterior mitral leaflet area remained constant, posterior to anterior mitral annulus perimeter increased. Multivariate determinants of MR were annular area, total mitral leaflet area to closure area, and posterior to anterior perimeter ratios. The study authors concluded that mitral leaflet area increases in AF with isolated annular dilatation and normal left ventricular function. The compensatory leaflet enlargement becomes insufficient with greater enlargement. Leaflets fail to match the asymmetrical annular remodeling and increases MR. Catheter-based interventions like transcatheter edge-to-edge repair has been used for atrial functional MR. Various devices to mimic surgical annuloplasty are being developed for the treatment of atrial functional MR. Theoretically, annuloplasty devices are expected to be more effective for annulus area to leaflet area imbalance. As these patients tend to be older and with comorbidities, catheter-based treatment might become the treatment of choice for atrial functional MR. Clinical outcomes with TEER in atrial functional MR from the EXPAND registry has been reported. 53 patients in the EXPAND registry had atrial functional secondary MR and 360 patients had ventricular secondary MR. In the atrial functional MR cohort, TEER resulted in significant reduction in MR through 1 year with MR grade 2 or less in all patients. Kansas City Cardiomyopathy Questionnaire score and functional class improved at 1 year follow-up. Another retrospective study had 118 patients of atrial functional MR. Technical success of TEER was 94.1% and MR reduction to 1 plus or less was achieved in 94 cases. In-hospital mortality was 2.5%. In multivariable analysis, a large left atrial volume index and low leaflet to annulus index were associated with a lower incidence of MR reduction to 1 plus or less after TEER for atrial functional secondary MR. First set of journal references. Second set of references. Third set of references. Thank you for watching this video. Please subscribe, like, share and post your valuable comment below this video. Kindly press the bell icon after that for getting all updates.